Welcome to Just Thinking. This is Mary Greendale. The title of this show grew out of a lifetime of curiosity about many different subjects. Some local, some global, and some in between. For each show, I will open with my thoughts and then bring on guests who explore the subject in greater detail. I hope the show inspires healthy discussions on camera and among viewers. To me, the sky's the limit when we are just thinking. Welcome to Just Thinking. Today we're going to discuss the drug situation in Holliston. Now, if you're one of those people who think that there isn't one here, I hope you'll watch this show carefully, and I hope that by the end of it you'll see that there just might be a problem here. Last February, there was a drug forum. It was put on by the PTSA, and it was well received. We heard a lot at that forum. We heard about the brain chemistry and development of youth and how that creates some problems related to the drug situation. Then the police got up and they talked about a bust that they had done, and they talked about all the different kinds of drugs that are appearing here in Holliston. Basically, if you've heard about it someplace else, we've seen it here, just not as often. So you might find some of these products are frozen, some come in powders, some they come in a variety of sizes and shapes and forms. One thing that surprised me was that e-cigarettes, the little vial that holds the nicotine that you use for to try to get yourself off of smoking cigarettes, drug folks will take it apart, put hashish oil in it, and merrily go about their business wherever they are, not violating anything that anybody else can think of. I've actually heard I have a grandson who's in the Natick school. I've actually heard that kids use them there. So I want to read you something that we wrote into an application for a grant that the Holliston Drug and Alcohol Awareness Coalition, that's the name of the group of in Holliston, recently submitted. And this will set the stage. We will then move to meeting our guests. Now, at that drug forum last year, one of the speakers was a recovering addict, and we are lucky enough to have her here with us tonight. She will bring a very, very different perspective for you, and I hope she helps open your eyes as much as she's opened mine. This year, we have lost 4 young people to fatal opioid overdoses. 4 may not seem like a lot, but think of this. Holliston lost just 3 soldiers in the Vietnam War, and none in subsequent wars. Yet we are losing this battle, and it's unacceptable. In fiscal year 06, the Holliston Fire Department treated and transported 6 overdoses. Between July 1, 2015, and today, that number has skyrocketed to 16 cases, and we're only halfway through. Actually, not even halfway through this fiscal year. I hope that serves to create a sober opening for this show, and let me introduce you to my guests, moving from my left to right. Gina Stucchi, hello. Kelly Alves, and Katie Sugarman. Thank you, ladies.
Thank you.
Thank you.
Okay, so why don't we start with Katie? And I'm going to ask you, please, just to tell all 3 of you serve on the board for the Holliston Drug and Alcohol Awareness Coalition.
Correct.
Henceforth, I will call that HDAC because it's way too long.
It is a mouthful.
It's way too long. So you all serve on the board right now. And what I'd like you to do is tell us, what brings you to that? What attracted you to participating in this committee? Okay.
Sure. Absolutely.
So Katie?
Yeah. So I am a certified prevention specialist, which means that I actually have a certification from the state of Massachusetts to do drug and alcohol prevention in communities. I'm currently the director of Natick Together for Youth, which is also a little bit of a mouthful, but that is the drug-free communities funded coalition in Natick. And I've been there for nearly 2 years doing drug and alcohol prevention in that community. And prior to that, I worked for the Revere Cares Coalition and the Watertown Youth Coalition even earlier. So I've been doing this work in a number of communities throughout the Boston metro area for some time. And I would say that I became the most aware of the opioid epidemic when I was working in Revere in 2008. The Metro West region is seeing some spikes in the opioid overdose rates currently, but there are pockets of the state who have been in the middle of this crisis for more than a decade. Revere happened to be one of those communities where I really got a lot of my experience and exposure working with this particular issue. Working with folks in recovery and their families, as well as folks who were, actively struggling with addiction, was one of the most eye-opening experiences for me, and taught me so much in terms of how the disease of addiction, and it is a disease, it is seen as virtually every medical authority in this country as a disease. It does not discriminate. It impacts families from every level of society, with every level of education, with every background you can imagine. There are many individuals struggling with this issue who feel stigmatized and marginalized. When I had the good fortune of actually meeting you at a Middlesex County conference on this particular topic, and learned that there was an opportunity for me as a Holliston resident to get involved in trying to address this issue right here in our own backyard. I thought I would love to be a part of that process. So that's kind of what brought me to the table.
Well, trust me, I thought it was more to my opportunity when I met you. I was there. That was the DA was holding. That was the DA,
the Middlesex
DA's office was presenting making a presentation, a series of workshop kinds of things on the subject from the perspective of treatment and prevention and the whole nine yards. It was really very, very good. And that's when we heard Chris Herron.
Yes.
And we'll talk about him again in just a minute. So anyway, Kelly, you want to take it from there?
So I'm a junior in high school. Unfortunately, I have a very close family member of mine who's struggling. So this has been happening for about 6 or 7 years. And ever since I kind of learned about what was going on, I always wanted to learn more about the disease and try and get myself out there and figure out, like, oh, can I do this? Can I do that? And then we came across Project Purple and Chris Herron, which we'll talk about later. And actually for a while, I decided that I wanted to make a team. But it was just me and my mom at the time. And then my mom found the uprising of HCAT, and she went to a couple meetings, and she came up to me and said, hey, why don't you come and kind of be our youth representation, if you want to put it. And then here I am.
Yeah, and again, we were lucky that you were willing and able and all the rest of it, because filling the youth slot might not always be that easy. Because the coalition is supposed to have again, we'll get into this, but is supposed to have a prescribed set of expertise on it from 12 different people. So anyway, all right, and Gina Stucchi.
All right, so I'm Gina Stucchi. I was one of the speakers at the drug forum, like you had said, and since then, after that forum, actually, because of that forum, we had a list of people that wanted to get together to start something in the town to try to combat this problem, and that turned into HCAT, and I got voted in as the chair of HCAT, and I come to this whole thing because I myself am in recovery. I struggled with a prescription opiate problem for a couple years that turned very quickly into a heroin addiction and anything else that was basically in front of me to soothe my pain. So I just am really happy that I'm able to speak out in the town and to start to try to educate others of what's going on, especially since there's a lot of people in town who think that, like you had said, the stigma. So I think that it helps for them to see that someone is able to get past an addiction and that they're able to be a functioning person in society and doing something like this aggressive to try to fight the problem. So,
Can we impose on you enough to tell us how you got started with the opioids? Because I think the way that you got started is so normal.
Right. So I was in a car accident, and at the time, I don't think I had ever been prescribed an opiate before in my life. So I was in a car accident. It was pretty bad. It was T-boned at like 40 miles an hour. And they gave me, in the emergency room, they had given me Percocets for the pain. And as soon as I took them, it was like something clicked in my brain that I've never experienced something like that before, where all of a sudden all my troubles just kind of disappeared. And, you know, even just the normal daily troubles that your mind just thinks about and most people can just handle, all of a sudden they just disappeared. And so just couldn't stop. I didn't realize that it had a physical addiction to it. I just kept taking them as prescribed, maybe doubling up every now and again, and then I started seeking them. And I got sick because I ran out of them, and I just started getting really sick, which is the withdrawal symptoms of an opiate, and I had no idea. I thought I had the flu, and someone actually told me what it was, and then I started just going out to bars and asking around and getting some more opiates, and they just kept getting bigger and bigger as, you know, the number of opiates and the strength of the opiate and all that. And it does something personally. I battle addiction, so I have the disease. Some people can take them and they don't have that. You know, my mother at the same time had her hip replaced, and she took them and she was fine. She didn't like the way they made her feel, and she couldn't wait to stop taking. And hers were just Vicodins. I was taking morphines, and by the time I switched over to heroin, I was taking morphines, and it was just numbing me out. And I liked that feeling, and I kept seeking that feeling because, of course, the path of destruction I was leaving behind me, my kids, my husband, my parents, my family, my job, all of that was emotional pain that I was dealing with. So to have a solution to that, I mean, you know, it was just one little pill will solve all those problems. So to not have to feel any of that emotional pain and the shame that went along with, of course, having the addiction, and that's how I got started. And from there, it just kept getting worse. And that was that was only like a matter of 2 months, maybe, that it went from a car accident to sticking, you know, to being a IV heroin addict. So it was
2 months.
Yeah, it was about 2 months. It was pretty bad.
Mm-hmm.
And before that, I just wasn't the type that would be doing that. So not my normal day-to-day activities.
Right. That sounds catastrophic.
Yeah.
You know,
yeah.
I mean, it is catastrophic, and it starts pretty easily, and I think that was one of the big takeaways for me. Mm-hmm. So let's jump back and do the Chris Herron, and just let's pick up on his story, because his story is another one that sort of blows your mind. Here's a man who had everything. You know, he was a successful basketball player. He had money. He had family that he loved. It wasn't a question of, you know, oh, gee, I don't really want to be with my family. It was, you know. And there he went, and he went that same path of starting with the pills, the opiates that I have been given myself, and like your mother, I don't like the way they make me feel at all, you know, and so it doesn't matter, I guess, but for anybody for whom it does, it's obviously a major issue. So let's talk about your Project Purple with Chris Herron.
So Project Purple it's a group that Chris Herron made, kind of little background story. He was talking to a high school. He saw a group of girls in the front row wearing purple, and they had raised their hand to ask some questions and got some snickers and laughs in the back. And, you know, he does what he usually does, which I love. He calls them out, and doesn't butter it up either. He doesn't let it fly. And the girl said, Mr. Herron, like, we are the kids in the school who took the pledge to not do drugs and not to drink until we're 21. So then he created Project Purple, which is for pretty much all students, mostly high school students, kind of a place for them to feel, that's what I'm looking for, not alone. And like, the group in itself, we're very like we're supposed to be very, I can't think of words.
Pressure's on.
I can't think of words.
I think it's the lights. It happens to everybody.
It's getting to me. They're very supportive. That's the word I'm looking for. I finally got it. So, you know, if a kid comes in and is like, guys, like I went to a party and I drank, and they're not going to be like, get out. Like, we're like, hey, it's all right. Like, we're only human, and that's kind of the part that I really took from it. It's like, we're all human, and we all make mistakes, but it's the people around you and how they support you that kind of makes it all the difference. And that's Project Purple.
Okay, so here in Holliston, we've taken it, we have our own little twist on this purple. You want to talk about Purple is for Prevention?
So, it's pretty much the same thing, but we're trying to get it into the schools. We're in the process of getting it into the schools.
And we were at the...
We were at Celebrate Holliston.
At Celebrate Holliston, had a good response there.
Oh yeah,
Very
we had
good,
a
yeah.
very, very good response. We had a pledge board out in front of the tent. And I got, must be over 100
There's a
kids
lot of
that signed it.
Good.
So it was,
Yay, Holliston.
yay.
Yeah.
It was great.
Yeah, that is great. That is great. And in Natick, where you are the coalition director, right? Okay. Do you use the Heron sort of format? Have you had Chris Heron come? Have you done Project Purple? Do you have a group that's in there? What are you guys doing with that?
So we do have a youth group that's a part of our coalition. It was actually created by Natick High School students, and they dubbed themselves NASA with 2 S's. That stands for Natick Against Student Substance Abuse.
Nice. Clever.
It's so they are not officially affiliated with Project Purple, but very much subscribe to the same concepts, same principles, same ideals of it creating a youth environment where not using substances is the norm. And the reality is that on any given weekend, most kids, whether it be in Natick or Holliston, most kids aren't using on any given weekend. Sure, some kids have used in the past 30 days and so on and so forth. Most kids are not using all the time, and there can be this skewed perception among a lot of young people that everybody's drinking, everybody's using drugs, and if I'm not at that party, I'm on the outside, And so the idea of, of Project Purple, of NASA, is really to normalize that not using is normal and cool, actually. So our youth group actually, kids have been very open about talking about their reasons for participating in the group. For some of them, they are student athletes, and so to get in trouble, with drugs or alcohol would be a violation of MIAA rules, and so that's the Massachusetts Interscholastic Athletic Association. So many acronyms, so much jargon, and so for them, they're committed because it would be a violation of those rules. For some of them, they don't like feeling out of control, or they don't like the way they feel under the influence of alcohol or other drugs. Some of them are very open about they themselves being in recovery or having a loved one who struggled with addiction and wanting to choose a different lifestyle and also promote that lifestyle among their peers and particularly around younger kids. They're really invested in how do we get this message to middle schoolers and younger. And so actually we're coming up on Red Ribbon Week right now. It starts this Friday night, and it's a national kind of just awareness campaign that's been around since the early 90s. And our NASA students decided that they wanted to promote a fantastic Friday event in Natick, and so that's something that the Department of Rec and Parks in Natick hosts periodically for middle school students, and so they wanted to host a Halloween-themed Red Ribbon, bash for 6th graders in Natick, and so that's something we're planning for this Friday night. So some of it's very social and fun, and how do we really, model for kids that this is cool, this is fun. Being who you are is way cooler than altering that with other substances. But like I said, for some kids, it's also the opportunity to be, to create that fellowship because they themselves are in recovery or they've seen somebody else struggle. And so that connection is really meaningful to them too. So, yeah.
Let me ask you one other question, Katie, before I move on.
Sure.
Can one community, as in the case of Holliston specifically, but this would apply to Natick, can one community take care of its own? Is it possible with programs and stuff that are available and so forth that you can actually manage to, because you're neighbors and because you're close and so forth, that maybe that you can actually provide direction and guidance and support and anything else that it takes? Do you think that's really doable? Are you finding that in Natick that you're building that kind of impact?
Well, I have to say there's a lot of evidence that the drug-free communities model, which is the federal grant that funds Natick Together for Youth, but also thousands of other community coalitions across this country, there's a lot of evidence after researching the outcomes of these different communities over the course of the past 20 plus years, that the communities that have had drug-free communities funded coalitions have lower rates of youth substance use across, as a whole. And the whole concept of a coalition is really how do we bring together multiple sectors of a community to talk about these issues, whether it's opioid related or alcohol related or marijuana or any other substance that the youth in a community might be using. The idea is to bring together multiple sectors to talk about what's going on, why do we think what are the local conditions that we think are feeding this issue, and how do we think we could, respond to this. And when I say multiple sectors, I mean everyone from, of course, schools, parents, youth, law enforcement are probably the ones that come to people's minds quickly, as well as healthcare providers, treatment professionals, but it also includes business owners. It really requires a shift in culture in a community to make inroads on these really tough issues, but communities do it. And it's not to say that any community gets youth substance use down to zero. That's a utopia that I doubt any of us will ever see in our lifetimes. Right. But significant declines happen in these communities all the time. Of course, there are some sectors that are hard to get to the table in a community if you're a smaller community. So a lot of treatment providers, hospitals, that sort of thing may not be located right in any one community, and you may have to reach outside of the boundaries of a community to really access all of the supports that your town needs. But communities are doing it all the time. So I do believe that a community can take care of its own, and it does really take brave people being willing to step up and put their faces behind it, whether it's somebody in recovery like Gina being willing to share her story, and it takes guts to do what Gina's doing, and she deserves to be applauded for that, because I think it can be easy sometimes to think about drug and alcohol issues in communities and think, well, all kids are going to mess around with it at some point, we're never going to stop underage drinking. Why do you even bother? That sort of thing. And like I said, I totally acknowledge we'll never get it down to zero. And I'm not a prohibitionist, and I totally acknowledge that adults who are of age and are responsible are totally within their right to use alcohol or other substances, other legal substances. But the reality is that when people are willing to put their faces out there and talk about these issues openly, not everybody has to agree. Part of a functioning coalition is to acknowledge that not everybody at the table is going to agree, and that there's going to be disagreement, there's going to be conflict at times. And as a community, can we commit to working through that and figuring out, there are evidence-based strategies that are endorsed by the federal government that we use in our grant funding, but it's not about there's not a one fit prescription for, if every community just implements these 4 strategies, the substance use rates are going to plummet. It's what fits our community best. And some strategies are going to work better for more urban communities, some are going to work better for more suburban or rural communities, and it really does have to do with making strategies fit the culture of the local community. What are the norms? What's the climate? So
Okay, well, that's encouraging as far as I'm concerned. So for the two of you who have direct or family relationships with the whole addiction world, there is a stigma?
Yeah.
How is it evidenced? How do you feel it? What do you know?
Do you want to talk about it?
Oh yeah,
It's all me?
Not all you. It's not all you.
All right. Okay, so I think that the biggest, I mean, there's stigma. Obviously, there's stigma all around it. Everybody thinks, like I already said once since I've been here, they think that, they used to think that, it seems to be changing a little bit, that if someone has an addiction, they're automatically, oh, well, that's the parents, or they were raised, maybe the parents were abusive. Or I know for myself, every time that I tried to go into some type of treatment, the questions that they ask you, they always try to figure out, like, well, you weren't sexually abused, you weren't, were you ever, as a child, were you beaten as a child, were you, it's not the word, abused as a child, but they ask a lot of questions that I'm like, why does it have to be one of those? Aren't there other answers? Aren't there other reasons? But they try to fit you into this, there has to be something. And I've actually had counselors that have said to me, you just don't fit the mold. You're just not, you don't fit the typical profile of someone who's an addict. I'm like, okay.
I don't know whether that's good
yeah,
or bad.
that's a great thing, but yeah, I know. I'm the only one that's like this.
Wow.
But that's people that work in the field. So it's not. But outside of that, I know personally, there's been a lot of stigma and the shame and the guilt, and just for someone who is trying and they're in early recovery, especially, I can speak for myself. There were times when I was maybe 2 months sober, and I would see somebody or run into someone, of course, in Holliston, and it's a small town, and I grew up here. And just seeing that person, and maybe the way I thought they looked at me, or that they didn't talk to me, or whatever the case was, just like it broke my heart. And I can honestly say one time I did relapse because of that, and not to say I wouldn't have relapsed for some other crazy reason, but it's definitely the shame and the stigma keep the cycle going of the addiction. So when you're using, and you have all this physical pain and this withdrawal that you go through to get past the first stages in your recovery, and then you have all this emotional pain, obviously, underneath that you're dealing with, and then to have people looking at you and judging you, or not being able to find a job, or not, it makes it so much harder. And I think that's a big part of why it's so hard for our community, or any community, to heal from this and to get past the next steps that have to be taken so that addicts can, I hate to use the word addicts, but so that people can get back into society and functioning. Because a lot of times they can't find jobs, they can't, if people just don't, if they know about what happened in their life, if they've seen it on the news or something like that, or in the newspaper, then they tend to not trust them, obviously. I mean, there's obvious.
Sure.
But another big thing, too, is with the families. The families aren't talking. A lot of the families don't want to talk about what's going on, because they themselves feel that there's a lot of stigma. They don't want, parents don't want their child to be thought of as someone who's a druggie or whatever. But of course, then there's the shame on the parents that their kid has a problem with addiction or substance use disorder. So they're not talking about it with even their neighbors and even other people in town that maybe could help them if they just knew that what was going on. That's what I've been finding. Something that I find a lot is ever since I came on this show, and then I did the other event and all the other stuff I've been doing, people out of the woodwork. I mean, just before I got here, I had I think 2 emails sent to me where people just need help, and they don't have anyone else to turn to, and they just know that they can talk about it with me because I'm so open about it. And I don't have every resource available. I don't know all the answers, and I direct them as best I can, from my personal knowledge. But if we could get more people talking about it, then more people can connect with each other. So what we'd like to do, or I know personally what I'd like to do, is get more people in the community that are willing to speak out. There are some out there. 2 of them reached out to me yesterday, families, parents that are willing to they've said, I see what you're doing, I read the newspaper article, and I want to talk. I want to talk about it. My child struggled, and one of them happens to be an educator. that used to work in our school systems, and she's willing to, talk about it openly, and she wants to help others, which I think is exactly what we need. Like, the more people that are open about it, the more other people that will start talking. And if we can just get past that, then we can start thinking of solutions as a community.
And I assume that's part of the goal with HCAT, is to open those opportunities and that encouragement.
Yeah.
Okay. So what is HDAC doing at this moment in time?
At this moment in time.
Does our chair want to take that one?
At this moment in time, we're taking a deep breath because we just, Mary, Katie, and I just finished the actual part of submitting an application for a grant. Obviously, you know that, which was a long process, something I've never had to do before, and I can't say I'm excited to ever do it again. But luckily, we have people that have done that before and are helpful. So we are looking to just get some seed money to try to get a little more visibility in the town. Our goal is to have some more visibility, and our goal is to get the rest of our board to fill out our coalition to get the other few sectors that are necessary for the drug-free community grant, and also to finish the assessment. So the assessment, which I feel like I've been talking about for a year, is we looked at the numbers. We got some data, some hard data from the Youth Risk Behavior Survey, which is done by the Metro West Health Foundation, which is done at the schools by the Metro West Health Foundation in the whole Metro West, I guess. So, and we got some data from the police station and from the fire station and a couple other sources. So we have a baseline of what's going on, the number of drug arrests, the number of people that have, overdoses, the number of drug-related situations, incidents, that are going on in town. Besides that, we are reaching out to some stakeholders, some people, it was really hard to get a list of 25 and squeeze in 20. We wanted to have like 65 at first, but we got it down to 25 people in the communities. We call them community stakeholders, and we're interviewing them with the same questions, each person, and we are tracking those results and looking. In the end, we're looking at those results as a whole and trying to figure out where the common threads are and what the community sees as being weak areas and what we could be doing better and who should be involved in that effort and a few other questions. And that's the first step in the process for the DCF, for the drug DFC. I keep saying it back. Did I say it backwards? Or the DFC, Drug-Free Community grant funding. That's the first step. We work with CADCA, which is Community Anti-Drug Coalitions of America, CADCA. And they help us. They're helping us through our 5-step process, the first step being assessment. So once we figure out what's going on in the town and what the numbers are actually showing us and some of the other information that we're gathering, once we have an idea of what's going on, but then we can figure out how to not fix it, but
address it in some way.
Because otherwise we're just going to put some stuff in place thinking we know all the answers, and that's not really going to fix anything. So I don't know it all, but I'm close.
Anybody who's done any interviewing, has anything come up that surprised you?
Haven't been interviewed yet.
So you get to be an interviewee.
I've conducted a couple of interviews so far, and I don't know that I would say that anything has surprised me per se, but the couple of folks that I have interviewed so far, I would say definitely demonstrated a commitment to working on this issue. Folks who are leaders in the town, and I do. That heartens me as a resident, to know that there are folks in leadership positions who are paying attention to this issue. So that was at least encouraging and enlightening to me. I don't know that I heard anything that was particularly surprising.
Maybe you've been in it long enough now that it's not
anything
surprising to surprise you.
And working in the city, you must have heard a lot.
So what kind of services, if that's the right word, do you perceive or think that HDAC will be providing? Are they
I mean, I can
Yeah,
speak to
maybe.
what coalitions often do. I mean, since we're still in the assessment, period, we'll have to, see in a few months kind of where our strategic planning process takes us. But, historically, in other communities I've worked in, we've looked at policy and enforcement related issues. So what are the either local or state laws that are impacting, local conditions in the community? And do they need to either be changed or tweaked in some way, or do they need to be enforced more consistently in order to promote a certain message? So, enforcement could include, social host liability laws, for instance. So if a community, and I'm not saying Holliston or Natick, just any community has a lot of underage drinking parties happening every weekend, and even though there's a law on the books saying that parents or adults shouldn't be hosting these parties, and they do it anyway and nobody does anything about it, maybe there's something there around enforcement that needs to change. When I worked in Revere, something that we heard a lot, and is still something that I think the state is struggling with, is that folks who were struggling with opioid addiction were often scared to call 911 because they were worried that they were going to get in trouble. And in every community, there can be nuances to that. So in some communities that have a high concentration of immigrants, it might be fear of deportation, or trouble with their immigration status. In some communities, it might be a fear of, the state getting involved and taking their children from them, and other, for other people, they might be afraid of calling 911 because they just don't want to go to jail. I mean, any of those reasons are certainly plausible and reasonable. And yet when we were talking to our police department, they were often telling us we rarely lock anybody up for just drug possession. If we have arrested somebody at the scene of an overdose, it's usually been because there's been an outstanding warrant or some other evidence of a crime in process. And so, when I was with that coalition, we actually were part of the state the advocacy at the state level to get Good Samaritan legislation passed, which did pass a few years ago. Mm-hmm. And now the state law does say that anybody who is at the scene of an overdose and who calls 911 seeking assistance will not be prosecuted for being there in the presence of it. Now, again, if there are outstanding warrants or crime in process or intention to distribute, I mean, those nullify the Good Samaritan law. But trying to make changes on those levels just to create an environment and then educating the community that law is in place so that people feel safer calling 911. So, so you can do policy work, but if you're not doing the on-the-ground work to educate community members about those things or educate them why it's worth their while to comply with a law, why it's better for their kids to not host underage drinking parties, what have you. If you're not doing some of that education building and awareness, laws can just be forgotten in dusty books. And so you kind of have to combine them. And then, a lot of the other work in coalitions tend to focus on, okay, where do we lack access to treatment and services and programs? So how do we start to network with local treatment providers or local healthcare providers? How do we start to create more of a network so that, when we do get a parent who calls and says, I just don't know what to do, we can offer them a resource or a phone number and say, call this person, call this agency, they might be able to help you. And that kind of gets to what I would say is kind of the last area that coalitions tend to work in, and that really is building that collaboration. That community connection can really make all the difference, because so frequently folks are at higher risk for substance use and a whole host of other risky behaviors when they feel disconnected. Mm-hmm. It could be that they feel marginalized because of stigma, but it could also just be that they're lonely, or they're struggling with mental health issues, or they're not from a community. And it can be hard and scary to step out of somebody's comfort zone and connect and reach out to other people. And so the more we can foster connection and collaboration among a community, the higher the chances of creating, kind of an interwoven net, a safety net that can really catch folks and hopefully prevent folks from falling through the cracks.
And families.
Absolutely.
That's the other piece, and I know Gina talks about this a lot, is that finding a way to be there maybe in some sort of peer support relationship that you can help the families who are feeling the shame, the guilt, and all those other things that they really, you wish they wouldn't, but okay, you can understand why they do, and that you're able to provide some sort of solace in that situation, just as you would if they had, somebody had gotten cancer, or somebody had been in an automobile accident and was paralyzed, or I mean, when that was part of what just kind of overwhelmed me after that drug forum, was that when there's a fire in this town, everybody helps. They, the family is just inundated with whatever it is that they need from day to day, and it can be furniture, it can be money, it can be anything. We're there, just like a snap, okay?
This town's awesome.
It is awesome. It is awesome at that stuff. And so my hope is that we will be awesome about supporting the families of our troubled youth, adults, or otherwise, and while we'll probably never be providing direct services, I don't see us being mental health providers and all those kinds of things. I have a trouble with my own. I am not qualified. but
there's a lot of people that are qualified in our town, whether or not they're, the people that would. There's a lot of people in this town that we could refer to that can help us get people into where they need to go. I mean, we even just on our coalition, we have.
Yeah, you do have.
I think it's three social workers and a doctor, and so just there in that little group, we have all that, and so many other people have reached out to us that live in the town that are in the social work field, counselors, and then we have Framingham and Milford on each side of us, basically. There's a lot of services there, Spectrum and Riverside, I think it's called, and so just kind of connecting with those. Go ahead.
Sorry, I feel like once people start to understand this disease a little more, because that's kind of one big thing, is people don't really understand it. They don't understand why it happens, really. They don't understand what happens mentally, and I'm in high school, and throughout middle school we learn like the kind of basic general, this is what happens when you do marijuana, this is what happens, this is your brain on drugs, this is your brain off of drugs, and we get kind of that basic, but we don't understand really, or we don't learn the scary part of it. And I feel like once people and students and parents start to learn the scary stuff, they'll be like, oh, wait, this person needs help. And I feel like once more people understand, it'll be like, kind of like they went through a fire.
Right.
Be like, here, do you want to talk? Here, do you want pie? Do you want to eat your problems? Pie, please.
Or with ice cream.
Any problem.
True.
Ice cream's good.
Better. Ice cream's good.
Both is always better.
Oh, yeah. A little bit of both.
The thing that, another thing that, sort of rolls around in my head is that we have this population of 18 to 25-year-olds, or maybe it's even a little older than 25 these days, because everything seems to be getting pushed off. But we have this population of 18 to 25. They seem to be the ones that are most often the overdoses or, unfortunately, the deaths. Boy, I mean, we can't afford to lose this population. I mean, we just can't afford to lose this population. And so how do you reach those people? Because in some cases they may or may not be away at college. They may come back from college after 1 year, 4 years, or whatever. They might never have gone to college. They might have gotten an apartment here. I mean, there could be any number of reasons that bring them to here in that age group. How do you work with that?
Well, I think it does go back to figuring out what is the infrastructure that already exists in town that connects to those those populations. I mean, I've seen communities do social marketing campaigns around awareness. Where they're putting posters and information in bars and inside the stalls of bathrooms in bars and restaurants, social areas where folks in that demographic might be hanging out.
Definitely the demographic,
but it also it does include. I mean, in Holliston's case, being that we're a small community, we don't have any major universities or colleges within our boundaries. But looking at what are from if we are, and I would imagine Holliston High School has this data demographic, as most high schools do, kind of where some of the universities or colleges are that are biggest draws for Holliston residents. Is there a way of accessing Framingham State University or other, other nearby colleges where we know that a number of our kids are going, to kind of get a sense of what are they doing around this issue? Because I will tell you, this is a scary issue for college campuses. I mean, it's especially college campuses in the Boston area. I think there are a lot of universities doing stuff around this issue, but we would never hear about it back in our communities, So there are connections to be made there. But, what other agencies or organizations might be available to support those who have, left the public school system, but are kind of in limbo right now? Certainly we have some folks who go into, into the armed services, and there are avenues often for accessing those through, offices of Veterans Affairs and that sort of thing, to figure out how can we help the folks in that demographic. And we do know that veterans are at higher risk for this issue. I mean, especially those who have seen combat. They're coming back with, awful injuries and are often being prescribed these very strong opioids. So it really starts with kind of, and this goes back to the assessment, kind of assessing where does that population already exist in our community, who already has some natural inroads to connecting with those populations. Churches would be another.
Businesses. I'm just thinking, your dad's business. I mean, you've got young people that come to work there, whether it's just summer or whatever. I mean, there's another avenue. And the other thing that about that particular age group that just I just constantly have ideas. That's all I do. But it made me think, why aren't there sports games and sports teams for that age group?
Right.
I mean, we got the guys that do it that are over 40. We got the guys that are doing it that are 4 years old. We've got everything for 14 years old and 18-year-old and that kind of thing. Why isn't there a program, if it's not Little League and it's not Pop Warner and it's not, why isn't there something for that group? I got to think that there's a real, obviously there's a real need, and sports is a common language for a lot of the population. And is there a way to look at that? So as we progress, someday that may be something that I'll dabble around with and see, how do you create a whole. How do you create a league, that sets up with, other towns, so that you can get a broad participation?
There are some too. Like, I know from my husband, he's been playing volleyball since he was like 4, but he plays with guys from Holliston that are in that age group, and he's a little older than that age group, but he's consistently since he was, a kid. And there's a lot of leagues like that are out there. They're just not. They're kind of like undercover.
Under the radar.
Yeah, they're not advertising really, but they have them at the local gym, not local gyms, but the Y.
Yeah.
The Y. There's a lot of leagues there, and then some of like Franklin. What is it? That school there, that they have, Tri Valley. Is that what it's called? Tri County.
They have the YMCA. Is that what you mean?
There's a I think. Anyways, there's some schools, there's some places that they do have those leagues that are going on. I think maybe we just don't, because we don't have. But I bet a lot of them are people in our town that are going to some of those different ones.
I know there's a basketball one in Framingham for. I don't remember.
Yes.
I think it's Salvation Army.
Okay, that
I think
makes sense.
it's
So maybe we
because me and my brother went a couple years back. He was helping there, and it was 25-year-olds down to like 10-year-olds, but there was a lot of kids in the 20s and
youth groups.
So it's obviously it's a big issue.
It's a big
So there are many parts and pieces to it and so forth. So the coalition is going to do its assessment, then it's going to do a strategic plan. I know you're going to be producing a website and materials and so forth to go out and navigate with the community, navigate among the community, and try to get the word out and so forth, and try to recruit people. Do you have any specific events coming up that you're planning to do?
Happen to have one.
Oh my gosh. Look at that.
Imagine that.
How could I have known?
We will be at the Holiday Stroll, which is the HBA, and we'll be at Jordan Hall up on the stage.
Okay, now let's talk. Holiday Stroll is the Saturday after Thanksgiving?
It is.
Okay.
It is the Saturday after. I'm glad you know.
Yeah, I'm pretty sure that's right.
Yeah, I was sure you know. The Saturday after Thanksgiving, and we will be in the Jordan Hall, and we're not really going to talk about what we're doing yet, but
Okay.
it's going to be something that would involve, a little activity, and it will involve any age group, and it's a positive thing because it's, right after Thanksgiving, so we want to talk about what we're going to be grateful for and a positive.
Great.
Trying to bring community together. That's the ultimate goal. So.
Yep, yep. Now, you said that there were some positions on the board that still need to be filled.
We still need a treasurer.
Oh, we need a treasurer.
We are still looking for a treasurer. That's a tough one. Nobody likes to.
Yeah, nobody wants to do that
Nobody
part,
wants
huh?
to do the money
Okay.
part.
And will you be fundraising?
We will be fundraising.
Okay,
Yeah,
so
it is in the works. We have a few ideas that we're kicking
Working
around,
on.
but yeah.
Okay. And are there other vacancies besides that treasurer? Do you have positions available if people are interested?
There are a couple positions on the board. We just need to fill a few more. We need, I think it's 2 or 3 members because things just shifted a little bit. So it's 2 or 3 more members that we need on our board. But then also we have people that just come to our meetings who are just not voting board members,
Right.
but they are very much involved in what we do, and so we really welcome anybody. Our meetings are finally set for the second Tuesday
Okay.
of every month
Okay.
at the Holliston Fire Department meeting room at 6:30.
Okay, that's at the Central Station, Fire Station, upstairs. And it's open 24/7, so.
Right. Yeah.
Anyway, before we start to wrap this up, I just wanted to go back to one thing, and that was that as you're developing this coalition and so forth, what do you think is the elevator pitch that you will make? That 2-minute, 2-second, however, 20 words. What are the 20 words, the 30 words that you say to people about why they should get engaged, pay attention, know that this issue is not something to sweep under the rug?
Right.
And you might all have a different vantage point because you come from different places in this. So let's start with you, Katie. What do you say to somebody about...
She's been doing this for a year.
Right.
I have to sit here and try to write mine down.
That means I actually have to sound intelligent, and I don't know if I can pull that
please.
off at this hour. I do tweak it a little bit depending on who my audience is, but usually I talk about how we're trying to bring the community together to work to prevent and reduce youth substance use. And whether you think the issue impacts you directly or not, the reality is our entire society is impacted by addiction. It costs our society a lot every single year, but any individual lost to the disease of addiction leaves behind in their wake a lot of people hurting, whether it's children who no longer have a parent in their lives, or parents and siblings who have lost that key individual, and that requires the rest of the community to pick up the pieces. So we all have a stake in this, whether or not we've actually had a person struggling with addiction in our immediate family. So.
Well said.
That's kind of the way I pitch it.
No, you cannot just say what she said.
I'm not going to pull that little move. Yeah, what she said. No. So when I'm explaining it to my friends because they saw me at Celebrate Holliston, and they're like, hey, what was that all about? So basically I'll go in and I'll explain Project Purple because it's my main focus while I'm here. And I say it's one big happy family. But we want to support each other, and we're here to learn as much from each other as we can. And, the more people we can, the more stories we get. And really, you hear it a lot, and unfortunately, everyone knows someone that's an addict or is going through that disease. So why not, try and make something out of it? And that's why we have HCAT.
Okay. Yeah. Can you top this?
I always say that it's something that I think I stole it from Chris Herron, to be honest with you, someone that I read, that for each person that does have an alcohol or drug problem, there are dozens of people that are affected by that. Like, kind of goes back to Katie stole that from me. She saw what I wrote down. But, you know, there's employers, there's family members, there's, you know, mothers, fathers, their kids, there's just neighbors, everything. There's so many people that are affected. And so a lot of people want to think it's just that one person's problem, like, oh, you know, that's their problem, and but really it's not. It's all of our problems, and so, but there's so much silence around it. So my big thing is really just talking about it, and I think that the more I'm living proof now, and at first I didn't really know if I was telling the truth when I said that, but as the more I speak out, the more people speak back about it, and that's definitely showing me that that's the truth. If we start talking about it, people are going to keep talking about it.
Yep. Okay. Well, thank you all very, very much. I appreciate you coming on.
Thank you for having us.
We'll keep our eyes on what HCAT is doing, and we'll see you again sometime down the road and see how things are going. Okay. So, thanks for being with me tonight, and we'll see you next time. And I have no idea what I'll be thinking about at that point.